So I am continuing with this is the conclusion of this series. This is part 3. We are on line 13. So I'm going to discuss where I educated the patient to notify the nurse. Here you see I did not write extremity that IV is within normal limits. Writing within normal limits might get you in trouble if you get called into court. It's kind of like saying what's within normal limits to you. What exactly did you assess? So as you can see here, I have written out what I assessed. I assessed for pain, redness, hardening of the vein, which might imply that the patient has developed phlebitis. And I've also assessed for swelling. Patient verbalized understanding. It shows that I asked the patient, do they understand? Now, as I'm getting ready to leave the room, you want to make sure that any of your patients know how to ask for help in case they need it. So I always document that the call light is within reach. And I have documented that the patient demonstrates how to use the call light. I have taken it a little further here. This patient has showed me that they know how to use the call light. So if anything happens, they knew to use the call light to ask for help. And they also have showed me that they know how to use the call light. So I know that they know how to ask for help. And I documented that they denied questions. I did not write no complaints. What's wrong with no complaints? No complaints is like saying, well, she didn't tell me that her head was hurting. She didn't tell me, so I didn't ask. And you don't want to do that as a nurse. Denies question is saying that you were a responsible caring nurse and you asked your patient, do you have any questions? And the patient denied that they have questions. So you want to put denied questions. And then I put monitoring. Monitoring means that I'm going to continue to monitor this patient for my shift. I'm not saying that, hey, I'll be back in an hour. I'm just saying monitoring because anything can happen within an hour. And I put my first initial, last name, and the name of my school with SN, meaning student nurse. This concludes the series on documentation. Comment and let me know, is your nursing instructor teaching you how to write a narrative? It used to be taught in schools, but now it's not taught as often. Let me know. I want to hear from you.